again, a topic I speak about. I do my own podcast, and I hope you don't mind the shameless plug. It's on Slice of Healthcare. It's called Nick's Notes, and
Go ahead.
and uh, but and I talk about this extensively. And again, I could talk for hours. But the U.S. healthcare system is an interesting quagmire, right? It's a $4 trillion healthcare system. To put that in perspective, the entire economy of India is $3 trillion,
Yeah.
right? So we spend more on healthcare in the US than the entire economy of India, right?
Right.
The entire economy of every country in the world except Japan and China, frankly, I think is those are the only two countries that have an economy greater than $4 trillion. The number one reason for the costs in the US is bureaucracy.
Mm.
When the US introduced insurance and private employer funded insurance, right? So the history of US healthcare, not getting into the whole history, is it was a largely cash pay system. Then Medicare was created. Then a tax break was created for employers to offer healthcare to employees. And that was in the 70s. And by the 80s and 90s, virtually all working people had, and certainly now, all working people have healthcare health insurance from their employers. Health insurance, not Medicare, but private commercial health insurance is a fundamentally inefficient initiative. And the reason is because insurance as a model does not work for healthcare. Insurance is a business that works when a lot of people pay into a system that very few people will use, and everyone's incentives are aligned. Okay. So let me give you an example. Fire insurance, okay, works. I don't want my house to burn down,
Right.
and the insurance company doesn't want my house to burn down. Life insurance works. I don't want to die, and my insurance company doesn't want me to die.
Right.
But health insurance doesn't work because healthcare is something we should use. Healthcare is like education. The more we provide it, the more we create a foundation for prevention, right? Educated people commit less crimes, do more this, do less drugs, all this stuff. Similarly, healthcare cannot be thought of as something that you should only use once you get really sick. It should be thought of as something you use to avoid getting really sick. A doctor-patient relationship, a therapist-patient relationship, a relationship with a nutritionist, the tools that help you give the ability to lead a healthier life. Yes, anyone can get cancer or a car accident, but short of those things, obesity, diabetes, hypertension, the main chronic disease in this country, can be reduced in scope substantially by a more preventive approach to healthcare, such as the one they use in Japan.
Right.
Japan has the highest life expectancy in the world. The average Japanese person lives 5 years longer than the average American, and they spend only 40% per capita of what we do on healthcare. So because they have a prevention oriented approach that starts from day one. So fundamentally the insurance model for healthcare is broken. And what that does is it creates an incentive for insurance companies to not pay for things, which means there's a fight between the doctor, the patient, and the insurance company as to who's going to pay. That creates a bureaucracy, and that's $1 trillion of healthcare costs in the US healthcare system, right? That $1 trillion alone should be gone, right?
Mm.
That if we went to a single payer system where the rates were mandated and the government paid, it would be every single thing that everything was, these things were covered for everybody. We would get rid of that bureaucracy and we could save $1 trillion on healthcare. That now there are many, many other reasons that go beyond that and data points about how healthcare costs have risen without a rise in whatever, but I'll leave you with this data point on this. Between 1990 and 2015, and at 25-year period, the number of doctors practicing medicine in the United States on a per capita basis increased 0%. Same number of doctors to population ratio. Over the same period of time, the number of people working in healthcare bureaucracy increased 5,500%.